Hi there, I'm Dr. Yen and welcome to my channel, That's Why. I know a lot of you have expressed concerns about returning to your classroom in the fall. Because of that reason, I have invited our local Story County public health nurse, Teresa Ferrari, here to answer some of the questions that our subscribers had about staying safe in the classroom. Teresa is here to share tips and tricks on how you can stay safe, how you can take care of your materials, and the different kinds of routines and things that you're going to need to keep everybody safe for the fall. If you found that this video was helpful, I invite you to share it with your colleagues, hit the like button, subscribe to my channel, and then hit the bell so that you can receive notifications of the new videos that land on this channel. Thank you so much for joining me on That's Why. Welcome to our key learning group, and this is I just want to introduce everybody to Treasa Ferrari. She is a Story County public health nurse. She's from the Mary Greely Medical Center. She is actually one of our local nurses and does a great job helping out with the community and, sharing a lot of great tips and things like that to our local school district here. So Treasa, if you wanted to say a few things about what you do and the things you're involved in.
So as a public health nurse, we do a variety of different things, but this has taken up a good share of our time since this pandemic has started. But, we still as the flu season arises, we're going to get really focused on that and getting flu shots to people. And we also do a lot of immunizations. So we have a little variety in our job. And right now, though, this is on the most important issue that we're dealing with is getting kids or, fit testing nurses and answering questions with the schools and helping schools decide how they're going to go back and try to be as safe as possible.
Thank you. And just for people's information, Treasa is going to be talking a lot about some of the guidelines that are going on here in the state of Iowa. Treasa, you want to say more a little bit about what our school systems are doing, or what the mask policies are at our schools?
Right. For the state of Iowa, we do not have, our governor has not mandated that we have to wear masks. So it's basically up to the school district on what they choose. We have some schools in our county that are making it mandatory for their school. We have other schools that are highly recommending it, not making it mandatory. I just heard yesterday that some schools that aren't making it mandatory, they are letting the teachers choose in their classroom that they maybe can mandate in their classroom that the children have to wear masks. So there's different options. When your state isn't requiring it, then you have a little bit more choices and freedom. We've also had our governor say that students need to be in the school 50% of the time, in the classroom 50% of the time, or they can have their parents opt them out and do online. So that's kind of just been discussed among schools. So they've been working with that and trying to figure that out too. So as of now, that's kind of how it stands with the schools here in the state of Iowa. They need to be in classroom for 50% of the time.
Sure, thank you.
So,
okay, so what I was thinking about this next hour is we're going to talk about three major themes. And part of the reason why we categorize those is we had a number of teachers pre-submit questions, and there were a lot of really great questions, and they fell along three main themes that teachers had wanted to learn more about. So the three themes that we're going to talk about is, first, handling school supplies and classroom procedures. Next will be, about mask usage and hygiene, especially for young students. And then third, if we can get to it, is, eating policies and how you handle snacks and things like that in the classroom. So I've got a couple of questions here from people. And so is it okay? I'm going to go ahead and ask you some of these questions,
Sure.
and you can go ahead and share what you have. Incidentally, like I said before, for those of you who are just signing on, we are recording this session, It is going to be available on our Facebook page. I will also be posting it on YouTube as well. Treasa also has shared a number of great resources for teachers. Once this session is completed, we're going to put all of that into our distance learning toolkit. So some of you probably already have it. Those of you who don't, keep your eyes peeled because it's going to be coming out. We're going to be updating it constantly as we get new information. Obviously, a lot of the guidelines from public health safety will be on there as well. So let's start with that first question. Can COVID germs get on worksheets and Chromebooks? Are there suggested procedures you would suggest for collecting papers from students or handing papers back to students?
Well, first and foremost, the main way that COVID is transmitted is respiratory. That is what they've discovered. It's respiratory droplets. That's why there's so much emphasis on masks and social distancing because of that reason. There's been some research about surfaces, but not a lot. And so they're just highly recommending that, when you can clean surfaces, any sort of household cleaner works. Anything that says anti-germ or antibacteria you can use to wipe off things, and it takes about 3 to 4 minutes of sitting. So books, if you wanted to if you had a book that could just be wiped off with a Clorox wipe or something, that would be sufficient. Papers, they're really not saying a whole lot about papers. I talked to my epidemiologist today about that, and there's nothing to say that you can't hand papers back and forth. They're not, we all know that when kids are in school, there is a risk, and there's going to be, and that's just how it is. And you can't control everything, and we don't really know enough about this virus to say, that it's going to be on surfaces and how long it stays on surfaces. There's not any real concrete research that's come out with the amount of time that it stays alive on a surface at this time. You'll see different things in different, different areas saying different things. But so we don't say a whole lot about that other than just, have a cleaning thing on your table, and like when the kids leave the area, wipe it down. That would be sufficient. Any sort of areas that are touched a lot, like doorknobs, water fountain, bathroom places, have that. I talked to someone that was going to have someone just wipe that stuff down like every hour. Just kind of, it's up to the school that how often they want to do that. There's no set guidelines on how often, but they just highly encourage more frequent cleaning of places that are frequently visited and touched. And so, so that would be
Gotcha.
just the Clorox wipes work. Mm-hmm.
So it sounds like even with like Chromebooks and things like that, because you had talked about that earlier too, with computer labs and computer stations, wiping down the keyboards and things, correct?
Yeah, there's places like I checked with my library, like I had said, and they just make it a habit of every hour they wipe down the computers at the computer lab that have been used by people. So it's just like a routine of just more frequent cleaning and wiping it down. And
Gotcha. Okay, I'm going to read this next one, which comes from Suzanne Evans, who is an art teacher at United Community. She says here, my question concerns shared supplies. While I will try to avoid this when possible, some more specialized art materials are not economically feasible to have multiple classroom sets. I have seen many ways to disinfect supplies. My main questions are, is there a certain wait time that supplies can sit untouched to be safe? And if so, how long is that? If not, what cleaning is recommended?
So the wait time is still, it's not 100% sure. Like you had mentioned earlier about having a puzzle sit for 14 days. Well, that would be ample amount of time. That's what my epidemiologist said when I checked with him. But it's best, like any sort of art supply, if it's feasible, to just wipe it down. If kids are done using like a paintbrush or whatever, just have them wipe the handle down with a Clorox wipe, and that would be sufficient. So it doesn't need any special soaking in a certain, chemical or anything. It's just, it's easily killed by your normal household cleaner that you buy at the store that just all it has to say is kills germs. And just use that and wipe it down, and that would be good. And so then
Gotcha.
there really isn't any waiting time other than I think it sits like 3 minutes on
Oh,
it.
okay. So three
So that's
minutes.
it. And yeah, just basically until it's dry, and then it's good to use for the next student.
Gotcha. And
Mhm.
then, and as far as like robotics kits or puzzles and things like that,
Yeah. And
where
again,
it's
I wouldn't use those unless you can wipe them down. If it's
gotcha.
like when I checked with the library, they don't check out any puzzles that have more than 48 pieces, and they have to be so that they can wipe them down. And then they actually set them on the shelf for 3 days. But after they're wiped down, anything more with more pieces, they don't check out because it's just too hard to wipe down all those pieces.
Gotcha. Gotcha. And then, yeah, sorry, we're gonna bring up, so just to give everybody a little background, Teresa and I talked this morning a little bit, so
Yeah,
I just gotta
which was
remember you're new.
helpful. Yeah, yeah.
So, what would you suggest for things like, oh, sorry, what would you suggest for things like Lego blocks, for instance? I mean, can you
Well,
dump them in bleach or?
there really isn't any. Yeah, I know, because it's kind of hard to maybe go through all of those. I didn't see anything like if you say dump them in some bleach water, I'm sure you could and let them sit there for a little while and then just put them on a surface and let them dry.
Mm,
I mean, I would say, yeah, it's probably the same type of thing as like when you wipe it down, just 3 to 4 minutes, and then in that bleach water, and then just take them out and set them on a surface to dry. I mean, I couldn't really find anything that actually talked about Legos per se, but
yeah. But it's such a
it's just,
common thing to use
it
in
is,
class, you
it
know?
is. I know. And like sometimes you just have to become creative and weigh the risks. Like, okay, do I really want to, is this going to be too hard to clean? But I would
Mm,
think Legos, they would be easy to just dump into a solution of bleach and let them set for a while and then take them out and let them dry. I
gotcha.
would
And
think that would work.
it's a
Yeah.
10% solution, right? Is what CDC recommends.
Yes, yes. 1 cup, or yeah, that's what they recommend. And there are 70% of alcohol solution. Yeah.
Okay.
Right,
Yeah,
correct.
okay. Because I'm just sharing that with everybody because, people are wondering about the kinds of cleaners and things like that. But
Right. And if you go to CDC website, you can go to their environmental cleaning and it has all that stuff on there. It's very accessible to see what, because it's hard sometimes to remember all that stuff, but it has a good
yeah.
website on the CDC website that refers to what kind of solution you need, what, it has it needs to be EPA registered, but like when I was talking to earlier today, they said really anything that kills germs is sufficient. Doesn't have to be anything fancy. They've kind of said that from the very beginning, that it's a pretty easy virus to kill with just your simple cleaner household stuff that we have in our houses now. So that's good.
Nice.
You don't have to buy
Yeah.
anything special. Yeah.
Yeah. And then I know this came up in a teacher group a while back too. Essential oils.
Yeah, no,
Okay.
no. It needs to be, like I said, it needs to be EPA registered. And I know some people are wondering, well, what is that? But if you go to the CDC website, I don't have them all memorized either.
Sure.
You just can click on that link and they'll have all the EPA registered cleaners. But it does consist of just anything that has enough bleach or alcohol in it to kill germs, is what it does. So, yeah.
Excellent. And also, Teresa shared a link with me. Like I said, this is all going to be in our distance learning toolkit for you. But there's even a section on people who are sensitive to cleaners and
Right.
right what they can do.
Mm-hmm. Mm-hmm.
So
Yeah, I thought that was good. It was just it's a good tool to have to just look at that and see what to do if you're sensitive to them. Mm-hmm. Or you have
yeah.
asthma and those inhalations bother you, maybe stay away from the sprays and use more just the wipes. If there's kids in your class that have asthma, and that could set them off into an asthma attack or
Oh
something. Sometimes
yeah.
those sprays can do that, so you have to be careful with that.
Gotcha.
Yeah.
Gotcha. Okay, and then another question someone had is, I teach in small groups, typically for 30 minutes around a kidney table. At my desk is about 4 to 5 students. What can I do to protect myself? So this is kind of a segue into the next section.
Yeah, and again, it's going to depend. I mean, ideally, it'd be nice if those kids had masks on also, and if everybody had masks on, that's pretty much, if you can't social distance, you're 6 feet. it's best to both of you have masks on. That's the ideal situation. Just, either one of those cloth masks or, and as a teacher, you might want to even add a face shield to it. I know some teachers are doing that. There, in case a child sneezes or something, you have that face shield, and a face shield should come down below your chin. I know there's some that are a little, like at right below your lip. You want it kind of down lower. There's different face shields out there, so you want to make sure that it's a little longer. And that just gives you extra protection along with the mask. So that would be a good suggestion for a teacher, I think, and having the students with the mask. So
yeah. And speaking on that subject too, what do you recommend for putting students in groups? I know you and I had talked a little bit about that this morning.
Mm-hmm. Yeah, I mean, that's a hard one because number one is going to depend on how many kids are in your classroom. But ideally, it's nice to have them cohorted into like small groups so that if someone in your class, a child, then you can be like, okay, they were in that group all day long, so I know that's who they would have exposed to. And if they go to music class, then they stay in that same group, just so you don't have everyone mingling so much so that when it comes to trace back, figuring out contacts, you're like, okay, well, who were they all around? It just makes it easier and not have to shut down your whole classroom. We've heard, I think that's even been on the news, some schools that are in session have had to do that. And so to try to prevent that from shutting down the entire classroom, it's nice to keep like just smaller groups in areas. So it's a smaller number of kids that are affected and that would have to stay out of school.
Gotcha.
But that's not I'm not saying that's easy to do. That's just a highly recommending and come out and be creative and figure out how to do that. And it's going to depend too on the size of your classroom and how crowded it is and that kind of thing too. But
yeah, because you said the primary focus is not so much worrying about as much about the surface area as the water droplets, correct?
Exactly. The respiratory, even just the talking, the sneezing, of course, is way worse, and coughing. But even just talking, you spread droplets and stuff. So that's why they're recommending the mask, especially if you can't keep 6 feet apart. The magic feet number is 6 feet. If you can keep 6 feet apart, like I talked to a Christian school today that's way smaller, and they're able to keep 6 feet apart. And so, but not most schools can't do that. But, that's if you can do that, you're not as much at risk either if you can keep the distance from people, but that's just not possible in a lot of schools.
Gotcha. So then the next thing is the face masks, I'm assuming, as well.
Yeah. Mm-hmm. And, and they're good anyway, but at least, and because that's what it comes down to when you figure out who the person was in contact was, who were they within 6 feet for more than 15 minutes? Those are what you look at to figure out who's going to have to stay home in addition and self-isolate for 14 days, which is kind of a big deal, keep that kid home. I mean, although now the schools have got it set up so if that kid is staying home for 14 days, he's going to do online school.
Oh,
so
wow. Okay.
Yeah. So that's how the schools have, at least in Story County, they've had it set up so they would be able to do online classes and not miss school because they're staying home for 14 days. But
so then, for instance, I know this was a question that teachers had too, is if, so I'm just going to go right into mask usage and hygiene for students. What do we do if we observe COVID-19 symptoms?
Okay, so there's a list of low risk symptoms and there's a list of high risk.
Okay.
And the high risk is if you develop a new cough, if you have any shortness of breath, which is new, and now they've just added recently the loss of taste or smell, because that's kind of become a classic symptom with a lot of people. They lose their taste and smell both. And so if you have any of those three symptoms, just one of them, all of a sudden you've got this cough that you don't usually have, then that's a high risk symptom. So then you would need to go to the nurse's station as a student. Are you talking students or are you talking teachers?
Well, you know what? I bet everybody can benefit from hearing both. So maybe start with student and then teacher.
So if you're a student, so I was just talking, we're fit testing all our nurses, here are school nurses. So I was just talking to a school nurse today, and so they have it set up so if a student has a symptom, so the low risk symptoms, which are fever, headache, muscle ache, body aches, fatigue, sore throat, runny nose, congestion, nausea, vomiting, and diarrhea. So those are symptoms that are pretty vague and can happen to a lot of people for other things than COVID. But if you have two of those, so if you have two of those symptoms, so say you have a fever and a headache, or you have a headache and a sore throat, doesn't mean you have COVID, but it puts you at the higher risk. So then it means that you need, as a student, you need to let your teacher know, and then you need to go to the nurse's station, and she needs to have the full on gear of the N95 and the face shield, and call your parents. And if you're a teacher, then you wake up with those, then you need to stay home, of course. Same way with students, they need to stay home. But if it happens during school, you need to leave, and go to your healthcare provider is our recommendation. And then he'll determine whether or not you need a COVID test.
Gotcha.
And then you go from there. So, but if you just have a headache, that doesn't qualify you to get to leave school. You wake up in the morning with a headache, you can take some ibuprofen or whatever and go to school, go to work or go to school. But if you have the headache and the sore throat, if you have the combination, they kind of set that up as an alert to maybe you should get checked for COVID and go to your healthcare provider and get a test, or go to, Test Iowa or wherever you want to get tested at. But that's kind of, the guidelines they set up.
That's with the low risk symptoms. And by the way, everybody, don't worry. There's actually going to be a handy little sheet for all of these things afterwards.
Yes, I know, because it's hard to keep track of. Yes.
Yeah. And then
that's a good thing to have, in your classroom, and remember what the symptoms are, because those are common symptoms. But it just, to know whether to alert you to, this kid maybe needs to leave the classroom and go down to the nurse's station and go home and possibly get checked for COVID, just to keep it spreading.
Would you suggest having like daily temperature checks for students? I know that was one of the questions.
Yes, I think it's great. I think it's a great idea, but I'm not finding that Story County schools are doing that. I think they're relying on the parents to maybe check their temperature if they don't feel well in the morning. I think it's just, especially the bigger schools, I think they feel like it's too hard to do all that. I'm not sure. I think it would be it's a great idea. A lot of places do that when you go into businesses and stuff. But again, it's not required. It's just a recommendation, and school districts can decide for themselves what they want to do. And at this point, they're not choosing to do that. Following up on cases, probably half of them don't even have a temperature.
Half of them don't. Oh, okay.
Yeah, it's a good percentage that don't even end up having a temperature. So it's not, it's not even listed as one of the high-risk symptoms, really. It's listed as one of the low-risk symptoms. Now, if you, like I said, if you wake up and all of a sudden you're like, I can't taste breakfast. This is weird. I can't taste it. That's a classic symptom, and that's a high-risk symptom. But just having a fever alone doesn't really necessarily mean anything. I mean, I shouldn't say it doesn't mean anything. Is a low risk symptom. So you would want that combined with something else, like maybe a fever and a sore throat, or a fever and a headache, or, just not just a fever.
Gotcha.
So that probably is part of the reason that they thought they would just not do that the parents would check the temperature if the child is not feeling well or something like that.
And I just realized too, that also depends on the fact that kids are still pretty much asymptomatic. Am I correct?
Yeah. I mean, they're still saying that. We haven't seen a lot of kids up yet here in Story County. We're seeing, a few, we have seen, 18 to 25 year olds. Haven't seen a lot of school age kids, I guess I would say. We've seen a few, but we haven't seen a lot. But, they haven't really been out and about so much. So we'll see how if that changes when school starts. But yeah, the ones haven't really, from what we've been told, haven't had a lot of symptoms. But
gotcha.
No. It is.
Interesting. Yeah.
Yeah.
Okay, so let's see. So there was one question here. Should schools have special rooms established when a child shows symptoms?
Yes. Yes. We've talked about that with all the schools here, and they've all got an isolation room, a
Isolation room.
room that's separate from everyone else. So if this kid comes to the nurse's station and has these symptoms, they need to be put in this room. And they were just asking yesterday, it was about, because we have meetings every week too with the school nurses, and they were asking about cots, if they needed cots for these children. Well, we actually
Oh,
decided that chair would be fine, because you want them to leave the school as soon as possible. It's not like some illnesses when your child has a headache and a tummy ache and they lay in the nurse's station for a while. And no, you want them in this isolation room, and then their parents need to pick them up quickly, is what they're highly recommending. They're sending out letters to the children or to the parents too, and letting
gotcha.
them know that, don't let them stay there half the day until you can get away from work. Someone needs to come and pick the child up soon. So,
Yeah.
yeah.
Another question about that too. You had said, so for instance, if a teacher finds that a child has a high risk symptom, should they notify the nurse before going down there so that the nurse can go
Yes,
and up and
yes,
everything?
yes,
Okay.
exactly. Yes, yeah, definitely in that way. Because, your nurse has to put on her N95. That's why we're fit testing all these nurses. Because in order to properly wear an N95, you have to be fit tested. So you have to make sure that because there's different sizes and styles. You have to make
Oh,
sure the style and size fits you and your shape of face. And if it doesn't, you just put on any N95 without being fit tested, it's not really doing its job, because you're going to have,
wow.
because it has to fit really tight around the nose and around the face. And if it's not specific your size and style, it's probably letting some air in around the edges or whatever. So that's
Wow.
important
Okay.
too, to be fit tested. And we're just fit testing the nurses, but because they're the ones that are going to be in contact with these children more. But yeah, definitely teacher, call the nurse, tell them, hey, this child has these symptoms, I'm sending them to your office. And then she can get her N95 on and a face shield
Got
for,
it.
yeah. Mm-hmm.
Got it.
Yeah.
Now, just a side note, I was thinking about this. Are teachers able to get N95s, or is that something that's just occupation? Like, how would say, for instance, a teacher is a high risk person and she's going
Uh-huh.
back into the classroom. Is there a way that she might be able to get an N95 and get fit tested, or?
For one, number one, they don't recommend wearing an N95 unless you are taking care of a possible COVID patient,
Oh,
because they are scarce. There is a shortage of them. So we
mhm,
keep them just for healthcare providers for the most part. And because if you have a mask, just a regular surgical or a cloth mask and a face shield,
mhm.
you're pretty good. You're pretty safe. Just
That's good to
take that
know.
patient out as soon as as soon as the student has the symptoms, just have them removed from your classroom, sent down to the nurse's station. And then she's the one that's going to be dealing with the student a little closer and a little longer. So that's why we really feel they need the N95. And because even nurses at the hospital taking care of patients, they don't wear the N95 unless it's a COVID patient, for sure COVID.
Ah,
Because yeah, they're not been easy to come by, and they're not cheap, because
yeah.
there is somewhat, high demand. So we do have a fair amount. So we've been given um, some of them. When they get fit tested, we give them a handful of them so they have them, because you can reuse them. It varies from place to place on how long they want to reuse them.
Mhm.
Definitely not if they're soiled at all, but they
Got
do
it.
recommend, now that we're on that subject, like
Yeah.
if you wear an N95, wear a surgical mask over it or a cloth mask, because that helps keep it clean and
Oh,
protects it
okay.
from getting soiled. And I thought that's a great idea. So the nurses over at the hospital are doing that, and that way it keeps the N95 it helps it last longer. And
Nice. And
yeah.
then speaking of masks, you had talked about for teachers, one every day, correct?
Yeah, I think I don't know if the teachers are going to be wearing cloth masks, because they really should be washed after every use all day
Mm-hmm.
long. So it's kind of nice to have five and, have one for every day, and then you wash them at the end of the week. Or if you use the surgical mask, you should change it and use a new one every day. Yeah.
Gotcha. Okay. And then I'm just looking over on my other screen and just seeing if there's other comments. Rachel Zimmerman Brockman asks, if children traveled recently over summer vacation, should they quarantine for 2 weeks before going back to school in person?
It depends on the state
Oh,
they travel to. I just made a list of the states. They're the 34 states currently affected. So there are 34 states that if you travel to these states, you are supposed to quarantine for 14 days after you return.
oh, okay.
So there's 34 of them. You probably don't want me to name them all off, but I could send them to you.
That would be great.
And again, that's stuff that changes.
Yeah.
I just got this last week, so I probably should look and see if there's any more that's been added to it. But yeah, so it just kind of depends on what's going on in the nation and how the states are affected on whether or not you need to isolate when you return from those states.
And then where would you be able to find, like, if a school district or a teacher wants to, get the most current information on a state like that, would that be on the CDC side, or is there a particular
that would be on
that
the CDC side? Mm-hmm.
Okay.
Yeah.
Okay. Great. And let's see. All right. So I have here, okay, here's the tougher questions for you, Treasa. I'm sorry. It's not easy, right? There's no easy.
Well, and if I can't answer, I'll just say I can't answer, but I'll find out.
Yeah. Okay. So Karen is a first grade teacher from New Jersey, and she asks, what are your suggestions for keeping first graders in a mask? Can there be mask breaks outside or inside? Any other suggestions for primary grades would be most welcome and appreciated.
I know, that is hard.
Yeah.
And so I've talked to some people that are of younger grades, and they've kind of gotten a little creative. Number one, if people that are making masks, cloth masks that are fun designs, little kids like to wear things that are fun designs, and they're more apt to wear them if they think they're cool. And also they mentioned having like the band across the back as opposed to the ear things. Sometimes that might get uncomfortable. And but the band, how you have glasses and you have that band across the back for little kids to help keep them so they don't lose their glasses, and it helps with that. Little kids taking them off and they might put them somewhere and they don't remember where they put them, they lost their mask. This helps prevent it. They can pull it down and it's still with them. I thought that's a great idea.
Yeah. So across the back.
I know of schools in a different county, because like I said, Iowa doesn't have it mandated masks, so schools don't even have to wear masks if they don't want to. It's up to the school. Like this school that my grandchildren go to, they actually are letting the younger grades wear face shields only. Oh. They feel like that would be easier for them to wear, and it's better than nothing. So because I think it's fourth grade on down is when they think that it's kind of maybe a little more challenging to keep masks on. And also, as parents, just practice with your children. Before school starts, have them wear masks throughout the day and get used to it. Like with anything, if you get used to it, I feel like, I've worn masks long enough now that I'm kind of getting used to it. It's like part of your dress code, It's
like a bra, right?
It is, yeah. So, the more you wear it, the easier it's going to be. But I think the big things with little kids is not having them put them down and losing them, or other people touching them, So I think that whole strap thing is a great idea.
I didn't even think about it. So it's the straps that go across the back.
Yeah, and having them adjustable so that you can adjust to fit your head.
Oh, yeah.
So, and then... yeah, so those would be about my recommendations. But breaks, I think you could have breaks as long as you can keep the kids 6 feet apart. That's the key. If you say, okay, it's mask break time, and would be totally fine, but make sure that all the kids are 6 feet apart.
Yeah. Yeah. And I just want to add, I was talking to another teacher the other day, and we thought a great STEM lesson, I'm a STEM teacher. A great STEM lesson would be how far is 6 feet? and asking kids to like estimate
Yeah.
that and think about how far that
Yeah.
really is,
Right.
because we see a lot of adults who don't know what 6 feet are. So
Yeah.
maybe we could teach our kids to do it
Uh-huh.
first. So, we
Uh-huh.
were like, a pool noodle is a little shorter. It's about 5.25 feet.
Oh,
But like just figuring out how many desks, how, far is a counter, like that's a really
yeah.
good measurement thing too. So just
Right.
adding that to the
Yeah.
mix.
Yeah. 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 Good. Yeah. Good learning tool.
Yeah.
Yeah.
Let's see. Okay, so it says here, this one's a big one. I shared this in the morning with you, so I'm going to just read it again. My state is not requiring masks for pre-K students, so very similar to a lot of Iowa. How do I keep myself as well as students safe? I have an underlying health condition and I live in a multi-generational home. I'm going to combine this question with another one
Okay.
because I think it'll be helpful. And it says here, I have to push into a kindergarten classroom where students are not required to wear masks. So a lot of these are STEM teachers and they migrate to different classrooms.
Oh, sure.
Yeah, what can I do to keep safe? So that's one question. The other that was suggested, and I think combining them might be good. We have all heard about good hygiene practices, but some questions around practical things remain. For example, how do students or faculty handle clothes as they come home from classes after a day? How to clean jackets once it gets cold? And then what is it that nurses and doctors do when they come home?
Okay. Um, okay. So the first part of it, I would say best to protect yourself is to wear a mask and a face shield. That's
Got
probably
it.
about the best way to protect, and making sure that your face shield is below your chin, that it's long enough so that it's protecting you. And try and, for the most part, keep your 6 feet distance from the students. And really, if they're not wearing masks, that's really about the only thing you yourself can do to protect yourself is, of course, take care of yourself, get enough sleep, eat healthy, exercise, all those things that help you boost your immune system and make you feel better and healthier. Those are good tips too. I think that, that helps your body fight off things so you don't get the virus as easily.
Mm.
Um, and what was the second part?
Oh, sure. So that was one. And then the second part was like, what would you do with clothing, like handling
Oh,
clothing when you come home from,
so
because it could be on your clothes, right? Like you can
I don't
say,
know.
yeah.
There's really nothing else. I mean, you can't really compare schools to hospitals. Hospitals are a little different situation. They're dealing with more infectious stuff. And a lot of times nurses, myself, I used to work in intensive care, would change my shoes. I wouldn't wear the same shoes back and forth to work, but I never
Oh,
changed my clothes. But you don't really need to do that with this. You really don't. I mean, I checked with Iowa Department of Public Health before because you'd mentioned that, and they're like,
yeah.
there really isn't any evidence that you need to really worry about your clothes, or you just wash them like you normally do. Or, if you were a nurse and you were taking care of a COVID positive person, that person ended up being COVID positive, maybe you'd want to make sure that your clothes were washed separately. But again, they just, they can be, because I know some nurses do that. They go home and then they wash, especially if they're working in a COVID unit, but they're working with COVID
Oh,
positive patients. They wash their clothes separately or they just change, at work. But there isn't any guidelines or guidance out there that says you need to really do that in a school setting. Because
hmm,
like I said before, we realize when we send our kids to school, there is a risk. No one's going to deny that.
yeah.
So you can't, I mean, so that you just have to weigh the risks versus the benefits. And there is going to be a risk, but you can't, I don't know. There's just, I guess, there isn't guidance that recommends that. That's what I'm going to say. You can
Gotcha.
choose to do that, obviously, if you want to, but there really isn't
Hmm.
guidance that recommends changing clothes or changing shoes or anything like that.
Okay. It
So,
sounds like for kids, I'm just thinking, my son's school used to have kids put jackets in one area so that when they go outside, they have their jackets on, and then when they come inside, they take them off and then go wash their hands. So at least those things are not in the in the classroom where kids are learning. I don't know if
Right.
that's right. So,
Yeah. Yeah.
because this individual was asking specifically about jackets and, when it gets cold and stuff. But I think that's, that could
And all the
like having,
jackets, like I think of like in the elementary, they have them all hanging close together type thing.
yeah,
Yeah.
yeah. They usually have hooks and things, or at least
Yeah.
putting things in
Right.
designated areas, right?
Mhm.
Would probably be
Now,
helpful.
if it was feasible to make your hooks further apart so the jackets aren't touching,
Oh,
that might be an option, but I don't know if that, you have to kind of work with what you have and what's feasible, but I'm just thinking that would be an option because otherwise it seems like they're all just really close together and maybe it'd be nice to have them separate a little bit so they're not all touching one another.
yeah, yeah.
But again, it's not in our guidance or recommendations from IDPH or CDC about that kind of thing, but you can.
Yeah.
Yeah, it's just being creative and trying to brainstorm and
Mm-hmm.
thinking of ways that you could, but it hasn't been proven to be on clothes at this point in time.
Oh, good. That's
But I'm
good to
not
know.
saying it's not. But I'm not
Right,
saying
right.
it's not.
Yeah, yeah.
Just
It sounds more like the face shield and the mask are really the
because
primary
the
thing.
respiratory is the main way that it's being spread.
Gotcha.
Through respiratory droplets. Yeah.
Any advice on where you can go to get a face shield? I- I have never seen face shields for sale on Target. The only
No,
thing I can think
no.
of is, Amazon or someplace, right? But
I
even
mean,
then,
maybe you'd find them there. I don't
yeah.
know. I think
What are you looking for? Like, are there different kinds?
there is. And
Okay.
so you want to make sure, actually, I have one over here, but I
Oh,
think,
great. Okay.
let me see. And these were actually made by John Deere and donated to us.
Oh,
So,
how
with
nice.
the start of all this, there were a lot of people that were coming up trying to make things, making face shields and all that stuff.
Yeah.
But you want to have, so this is just real simple. It's just a band.
Oh,
So it
wow.
goes on like this, and so it comes down low.
Uh-huh.
See how low it comes? And then, you want this area closed off because I've seen some where this is open to the air.
Oh,
See how that, and that's
interesting.
just styrofoam, And so
Gotcha.
you want that so it's all the way sealed up here and
Mm-hmm.
not open to the air because then,
Okay.
germs can get up there. So this is
Got it.
so this is just a real simple,
So is that
made.
something that people can make then? It looks like it's
Yeah,
an
people have
elastic.
made them. People have made them. Like I said, I think it takes special tools.
Oh, I see.
I,
Okay.
I'm not sure how you make it, but I know people have been making them. So, but I've never ordered masks, to be honest. I mean, I get them through Mary Greely. I'm not sure they have their distributors that they get them from.
Mm-hmm.
I think schools are working with distributors and getting them from them. Schools seem to be getting enough PPE,
Oh, good.
protective, what is the word?
Personal protective
Personal
equipment, right?
protective, yes. Personal protective equipment. There seem to be getting that, and then so, but we did give each school nurse that came through and got a face mask.
Got it. For some reason, I kept thinking
Or
it
a face
was,
shield, yeah.
when you said face shield, I thought about like the welders with the giant helmet and everything.
Yeah,
So I'm really
yeah.
glad you showed me that because I was
Yeah.
like, okay.
And there's different styles. I mean, there is,
Uh-huh.
but that was just a real simple one and it works because it comes down nice and low or far it comes down so it protects you
Mm-hmm.
more. Because I've seen
So
some of them that stop up here and that's too short. You want them longer than that.
got it. So really what teachers need to be looking for is a face shield that goes below your chin and that is going to be able to fit snugly around your
Right.
head,
And there's not open up there. Yeah.
not open up
Mhm.
here. Got it.
Yeah.
Oh, that
Right.
was
Yeah.
that's really helpful. I'm learning a lot from
Good.
you. Thank you.
Good. Yeah.
Okay. And then what about like gloves? Because I know teachers have been asking about like how many gloves, is that a thing? Like, should kids be wearing them? Um, you
Mhm.
know, protocols on hand washing versus, hand sanitizer? Any tips that you can give maybe to make teachers' lives a little bit easier?
Well, they say the soap and water is the best.
Mhm.
And then next is hand sanitizers, works too. Because soap and water isn't always easy accessible, but that is the best. And then when, using hand sanitizer, make sure the students know to, get in their fingers on top and in there and get, because some people will just go like that. But you have to kind of get in between your fingers and get on the top and get it really, good. Same way with washing your hands too.
I was going to
You
say
don't
kind
just
of
go
the
like
same
that.
procedure, right?
Yeah,
If you
same
tell them it's
procedure.
the same thing,
Same thing as washing your hands. Yeah, you don't just rub it on your palms. You have to get it all over.
Got
And I
it.
feel like, students might need to be reminded of that.
Yeah.
But yeah, I think, and gloves, really, they're not, definitely the school nurses are going to probably put gloves on when the patient comes to, our student comes to their office and has symptoms. But as a rule, you don't really need to wear gloves. Teachers don't really need to be wearing them. Maybe if they have a box in their desk and the student comes and not feeling well and they're taking them down, maybe they could, it would be just fine after they did that they went and washed their hands.
Got
That would take
it.
care of that. You don't necessarily need gloves. Just make sure you wash your hands. And don't be touching your face. That's the big thing too. If you don't, should really get out of the habit of touching your face as much as, possible.
Yeah.
Anyway, anytime, because that spreads stuff.
And I've
And then,
seen people, like, I go to the store and I see it and I like shudder when they're like adjusting their face mask like this. And
I almost feel like the masks have made people touch their face more. They're not touching their face, but they're adjusting their mask, or their
yeah.
mask is falling down below their nose. Because that's the thing. Masks need to be up above the nose. And you see that all the time. They're down below the nose. And so then they're pulling it up for so you want a mask that's going to fit so it stays up there.
Mm-hmm.
It doesn't do any good if it's below your nose. It needs to be above your nose or up higher than your nose. Yeah, I know. I see that a lot. I'm just like, yeah.
Because really, like, even when you're taking your mask off and stuff, you want to avoid touching the front, right? Because
Yes.
if you're exposed, then all the virus is on the surface of that material, correct?
Yeah, the least you can touch the mask, the better off you are.
Okay.
But that's going to be a challenge with little kids, especially. Well, probably with any students, I think it's going to be a challenge not to have
Yeah.
them touching their mask. But
Does it make sense then? Because you had mentioned this before, the masks where the bands go around,
uh-huh.
for a mask break, is it better than to just have them pull it down below their chin instead of taking the whole thing off? Or what would you say there?
I don't know. That's kind of a tough one. I feel like for little kids, maybe, because if you set
Mm-hmm.
it down, then you might have other little kids touching it, picking it up.
Oh,
You
yeah.
have to kind of think about the ages and what would be the best thing. And that's kind of what the school nurse that I was talking to that's doing that said
Mm-hmm.
they were going to do. They were just going to have it so then the kid could pull it down and still have it on them.
Mm-hmm.
Because they're going to be touching it when they pull it up and down. They're just going to be. That's just kids just do that. But if you set it down, I have them set it down somewhere. Then some other kid might be like, "Oh, I like your mask," and pick it up, and
Yeah.
so that would be even worse.
As I was just thinking, like, they're
So,
gonna trade each other for,
yeah,
Ninja
right. I think
Turtles
you're
and
just
Care
like,
Bears and
yeah,
Pokemon.
yeah. So you have to kind of decide which would be the best, which is the worst of the two evils, because none of them are ideal, but
Hmm.
it is what it is, and you got to work with try to do the best you can
Yeah.
in this
Although
crazy.
it sounds like mask breaks is a good thing. Like, as long as they stay 6 feet
I
apart, they
think
can have
so.
mask
Yeah,
breaks.
yeah, for sure. And they're going to have their mask off when they eat. I think you'll probably get to that later, won't you?
Yeah, I guess. In fact, that's a great segue into it. Let me just
Yeah.
double check to make sure we've got everything here. Um, I know somebody asked in here, sanitize versus wash hands. I know wash hands is better. How often would you suggest?
Mm. More often the better. Really. It's just as often as they can. I mean, like in between classes, or at least have sanitizers, at least like they leave a classroom, have like an area there where there's a sanitizing stuff there, that they can just quickly sanitize their hands after that class and go into the next class. I think that would be really a good idea, to have sanitizing stations from like outside the classroom. So when you either leave that classroom or before you go into the next one, you will clean your hands. And because it's going to be hard to have everyone go wash their hands every time between classes. So hand sanitizing is much quicker, and and it's good to use. So that would be my suggestion, is in between classes, or of course if they get their hands dirty in the meantime. But
Gotcha. And then let's see. I just want to make sure I've got this. Oh, somebody asked here, what are procedures of days off when someone tests positive for students and teachers?
Okay, so if someone tests positive and you're, in order to be considered, so you're talking about the person that tests positive.
That's
so
what I'm assuming, from the question.
So if you test positive, it depends on if you have symptoms or not. So if you have symptoms, so positive people only have 10 days of isolation, because the virus stays infectious for 10 days. The 14 days is because of the incubation period of the virus. So if you have it and you're positive and you have symptoms, it's 10 days from the onset of your symptoms. So sometimes, you get positive and you find out the result and you had your symptoms 3 days ago. Well, then that counts. You've already started your 10 days. And so then you got your 10 days, and as long as you're fever-free for 24 hours and your symptoms are improving, they don't necessarily have to be completely gone, but just improving, maybe you still have a little bit of a lingering cough or lingering headache or whatever, but they're definitely improving and you've not had a fever for 24 hours, then you're out of isolation for after 10 days.
Oh,
if you don't,
okay.
if you never had any symptoms and you got tested for whatever reason and you're like, wow, I'm positive, I'm not even feeling sick, then it's from the day that you got tested, the 10 days.
The 10 days.
From your testing date, then the 10 days of isolation.
Gotcha.
And that goes for everyone, students, teachers, everyone falls into that category, yeah.
So then and the reason why I'm asking this is because we've always heard 14 days. So when does the 14 day,
if you're a contact. So say I was positive, well, my coworker and I, or anyone that was close to me within 6 feet. Now, healthcare providers, if we're wearing a mask, we are exempt from being in contact. Teachers, students are not. So a contact is a person that's within 6 feet for more than 15 minutes. So that's why contact tracing is really important, to figure that out on who. So when someone gets positive, then you call that person and then you ask the positive person, okay, who were you in contact with? I mean, students we're going to be relying on teachers and stuff for that. Who was that student in contact with for more than 6 feet for longer than 15 minutes? And then you get the names, then you call them, and then they have to self-isolate for 14 days.
For 14.
People that were in 14 days because of the incubation period. So, you've heard some people say, well, I'm just going to go get tested. Well, that doesn't really matter. You get tested and you're negative, that's okay, but you still have to isolate for 14 days.
If you've been in contact with somebody.
Yes, because it can take up to 14 days to actually, for the virus to become active in your system.
Gotcha.
You could be having it and spreading it, but it's not it's not showing up as a test or whatever. You could test today and you'd be negative, but 2 days from now you might be positive.
And you're shedding it the whole time, right?
Yeah, right. So that's why they have the 14-day isolation period, which is a long time, And essential workers, which include healthcare providers, and now teachers are considered critical workers, is what they're calling them. So basically the same. I mean, other than like if a teacher has, because I know they're taking into consideration that there might not be enough substitute teachers out there to replace.
Oh my goodness. Yeah. Now the shortage is even more because of all of this, right?
Yeah. So If there's a substitute teacher to take your place, great. That's probably what's recommended. But if they're not, you're considered a critical worker, meaning you're really important, which we know teachers are all very important.
Oh,
and
yeah.
then they need to go to work, but they would wear a mask and a face shield, and they would take their temperature every morning.
Oh, okay.
And make sure, just do a little bit of extra precaution. And by all means, if they develop any sort of symptoms at all, then they would need to go get tested and or go to their healthcare provider and see what they think.
And that's what you had said before. So if they develop some high risk symptom, especially like they can't taste breakfast or something, it's better for them to stay home, get tested, but then probably isolate until they get the test results, or
until they get the test result. Right.
Okay.
And if the test result is negative, of course, then they can go back to work after, like, say they have a fever, like any other thing, you need to wait 24 hours after your fever's gone. But then they could go back to school, if their test is negative.
Gotcha. Okay, that makes more sense now to me, because I was like, I hear 10 and 14, and
I know it's confusing.
Yeah, thank you. And so here's another question then, because you had talked about the masks. If both kids, so a lot of teachers have questions about kids working together. If both kids are wearing masks and even like face shields, can they then theoretically be closer than 6 feet apart and work together? Or is it still better for everybody to stay? Well, it probably is better to stay, at the distance, but.
Yeah, I mean, and they can. It is probably better, but no, they can. If they have those, they're taking that extra precaution. But again, if one of those students ended up positive, that doesn't, just because that they both had their masks and their face shields on, they still are considered contacts. It doesn't keep them from ever becoming a contact, which is, how they, and I think, it's just a rule they made. Healthcare providers are exempt from that because I think they feel like we know really how to wear a mask properly and proper PPE training and that kind of thing. So they're anyone outside of the healthcare field is considered a contact, except now teachers too can work if they've been a contact. So
Gotcha.
At least this is all for the state of Iowa.
Right.
Other states might vary on their rules on that, but
some of our teachers may actually use this presentation to inform their districts as well, because there's just varied guidance all over the nation right now. So,
yeah, there is. I know. So, and I don't really know what other states have. So, but I just know we all vary. So it's different.
Definitely. Okay. Since we're starting to run down on time, I'm going to ask this question, then I'm going to hop over to the group to make sure we've got any extra questions or things that they have there while you're answering it. But I'll be listening to, if I'm looking on the side, I'm just checking that screen. Okay. So let's go on to eating. My question is in regards to eating in the classroom. Our classrooms are small, no windows can be opened. Students will have face masks off in order to eat. Reality is that there will be talking, yelling at one another. How do you keep them in their seats when they want to visit? After eating, clean up, because of the talking, the room will be full of germs. So how is that going to be safe? What can we do? And then I'm going to couple that with the other one, which is it possible to still, serve healthy hot lunch meals instead of a cold lunch? Are there ways that, we can still do that?
Well, I know that is a hard one with the lunchroom atmosphere. I mean, if there's obviously, the first thing I would suggest is the 6 feet apart. Everyone's sitting 6 feet apart, because they're obviously not going to be able to have their masks on while they're eating.
Got it.
And try to, I don't know how you limit talking and yelling and all that stuff. That's going to be hard, but if they're 6 feet apart, that's very helpful and hopefully will help prevent the spread of it. I've talked to some schools have thought about like having those trays where they bring the food to their classroom. And you don't have everyone mingling or maybe having less people go to the lunchroom at a time. Because instead of having the lunchroom full of kids, obviously you're going to try and downsize that and have less kids in the lunchroom at a time so that they can keep their distance from one another. And just some suggestions that IDPH, Iowa Department of Public Health, had was, when possible, provide grab and go to individually plated meals. So again, that kind of goes with the trays brought down to the rooms. They just kind of grab them and go, and maybe they all sit in their classroom and they can keep their distance apart from one another a little easier. If feasible, use disposable food service utensils. That's kind of recommended too. Anything disposable would be better. And also, if feasible, consider physical barriers such as a sneeze guard and partitions, particularly in areas where it is difficult for individuals to remain at least 6 feet apart. So you could have, I don't know if that would be a lot to have like those partition barriers in, like, here this child sits and then this child sits over here. That's kind of probably not feasible, but
yeah.
It helps with the spread. But so yeah, that's kind of about, the big thing is just keeping the distance. And if you can take it to the classrooms, if that makes it easier to bring it, keep the students their distances, because they're all going to have their masks off. So you definitely want to have that 6 feet apart rule with the students.
Because then if they're yelling, at least they're yelling and they're 6 feet apart from each other,
exactly.
right?
Yeah. So that's the magic number, the 6 feet apart. So hopefully that'll help prevent the spread of it. But
and then any last minute advice you would give for teachers then as they're coming into the classroom that we haven't talked about, perhaps?
Yeah, the big thing is, protecting yourself, I would advise, teachers to be wearing a mask themselves, even if their particular school isn't requiring it. Wearing a mask and a face shield gives you a little bit more extra protection. If you want to wear the face shield, that's good. If at all possible, keep the distance. I'm trying to think if there's anything else.
Yeah.
Physical distance, face coverings, hygiene. We talked about that. Talked about cleaning. Talked about illness screening and testing. That's kind of...
A quick question about face masks, because I'm looking on Amazon and there's all different kinds that are out there right now. From the surgical disposable masks to now they've got these fancy ones where you can stick filters in and all kinds of things.
They say no filters.
No filters.
No filters. Filters is an area that things can get in it. No, they actually, I've been told anyway, that stay away from masks that have filters.
So is a regular single layer cloth mask okay, or double, or what's like the best next to an N95 for a teacher to get?
Well, like those surgical masks, there's different ones. I think there's level 1, 2, and 3. 3 is what like OR uses, the operating room. 2 is probably, which would be the double layer would be probably the best.
Oh, okay.
1 is better than nothing, but it's just to have that. But then they never used to say cloth masks were okay, and they're saying that's okay. So again, it just comes down to something is better than nothing. So, because a lot of people are making masks and
is it better to have a double layer when people are making the masks then, it sounds like?
I honestly don't really know about the making of the masks and how they're making them, but it seems to make sense. If it's a double layer, I just worry that might get too hot. Sometimes masks can be hot, and that makes it harder, especially for kids to want to wear it if it's hot. But so you kind of want to make them somewhat comfortable a little bit too. So,
and in terms of cleaning the masks, especially for, I guess for kids as well as teachers, throw them in the washing machine? Oh, okay.
Throw them in the washing machine, wash them like normal. And you should do that after every day of use. So that's why it's good to have at least 5 days so that you're changing it out every day. And of course, schools will need to have extra masks there in case the kid forgot their masks, which will probably happen. So having those extra masks or just some boxes of those surgical masks so the kids can wear those. The one thing that, we hadn't talked about was busing. I don't know. I know we've talked to schools about buses, and some schools are setting it up. Again, it depends on the school and the financial situation that the school's in. If they can afford to have more buses and bus kids more, because that way you can have them, ideally, one person per seat and every other seat. Well, that doesn't hold very many children. So not all schools in our county even is going to be able to do that, but they are mandating on the buses that kids wear their masks when they're on the buses. And then of course the bus driver is going to wear a mask and a face shield both. And they're actually having someone like a bus assistant on the buses to help monitor the kids and making sure they stay in their seats, because buses can be pretty rowdy and kids up and down, and the bus driver can't really be tending to that. So
yeah, I'm just thinking even driving with the face shield is going to be
right?
It's a challenge.
And maybe when he's driving, he can take it off and just have it on when the kids are walking past him, because all those kids are walking past him. But
gotcha.
So we'll see how that all goes. But they're requiring that they have a mask when they get on the bus, and then they wear their mask. And ideally, it's nice if you can put families together. Like if you have 2 or 3 siblings, have them. Sure, they're gonna, sister's gonna want to sit with brother. But I mean, that works the best, ideally, because
that makes sense.
Instead of sitting with your friend. But
that makes a lot of sense.
Try to encourage that and encourage parents to bring their kids to school, so there's less kids on the bus.
Gotcha. A quick question too, if you have a little bit of time. Okay. Is I know in Des Moines there was a lot of discussion about parent pods, where families are getting together to homeschool their kids. So any, quick suggestions or advice for them, because there might be some parents that are going to be watching this as well.
So they're having their kids all get together?
My understanding is, and I mean, they're still going to have to think about the social distancing and the masks and things like that but I'm guessing a lot, my understanding, and again, I haven't, I'll just be honest, I've only learned about them in the past 2 weeks. So it's new to me, but my understanding is several families then would, I guess, rotate their kids to these different houses to learn. As an alternative to having all of them go to school. So I'm assuming it would be, having kids in one house for a certain period of time. Any changes or, or anything, any thoughts about that at all?
I mean, it would kind of come down to the same thing we've talked about. They need to be, they're 6 feet apart. They would still need to wear their masks. I suppose they're looking at that they get some of that friends interaction, because a lot of people are thinking kids need that, and so that's a good thing. But they would still, have to follow all those guidelines of the 6 feet apart and the masks and the cleaning, and there really wouldn't be anything different from that. I guess they're going to be exposed to less kids, obviously, and they're not going to have so many to go back and. But it still would be, the same type of thing. If they were in close contact, they'd be a contact trait, have to isolate.
Oh, yeah.
So,
gotcha.
I can't really think of anything else that would be different.
Yeah. You're right. And I just, there you go.
Yeah.
But I guess as a parent, if they're over at your house, you're going to need the face shield, the mask, and maybe even the face shield too, it sounds like, as well.
Right. Mm-hmm.
So, okay. Yeah. So thank you so much for joining me.
Well, I hope I was helpful.
Oh, yeah.
And if you have any other questions, let me know, and if I don't know, I'll find out for you. And so hopefully you can find all those links that I set you helpful. I think they've got some good information on them.
Absolutely. So Teresa's shared a number of links. A lot of these are from our Iowa Department of Public Health, but we also will be sharing some CDC links that she has pulled together and so on. Those are going to be in our distance learning toolkit for you. Like I said, there's a bunch of other resources in there to help you with that. But that way, you know, we can continue to update and stay current on some of those things. If you have any questions at all, please feel free to, you know, put them in the comments in either the Facebook group post that you see or in the YouTube later when this gets posted on YouTube. So thank you so much,
Yeah,
Teresa. I
you're
really
welcome.
appreciate it.
You're welcome.
So one more thing, don't forget to subscribe to the Distance Learning Toolkit below. It's free. It's got all of Teresa's resources along with a ton of stuff that my team created to get you ready for the fall. The other thing is that we are holding Disaster Proof Your Elementary Teacher Training. It is a 10-step day-by-day challenge to get you a parent letter, a plan, and then a ton of resources to build engaging lessons, whether you're in face-to-face, online, or anything in between. Thank you so much for watching. Don't forget to share the video if you found that this was helpful to you. Subscribe, hit the notification button for new videos, and I'll see you soon. Bye now.